Hey guys, my name is Eva, and this is my very first ever YouTube video. And before I talk about tonight's topic, which is hair loss, I wanted to say something very clearly, and it's that if you are suffering from hair loss, it is not vain to care about your hair or your appearance. Hair loss affects how we feel in our bodies, how we feel as women, our femininity, our presence, our identity, and it's completely normal to want to feel embodied, to want to look a certain way, to feel dignified in our bodies. That is not superficial at all. I think that's deeply human and part of our operating system as women, and it's something that we should embrace and not have any shame around. I wanted to come here tonight to talk about my personal journey with hair loss, specifically PCOS-related hair loss, iron deficiency hair loss, and androgenetic alopecia. So these have been forms of hair loss that I've been dealing with for like 15 years, and it's something that a lot of people don't even really know about me because I've treated it so successfully. But I became obsessed and fixated on how to optimize my body and move out of hormonal dysregulation in order to balance my body. And in doing that, I learned a lot. I learned a lot along the way. I've spoken to countless specialists, some of which are the top in the world, and I've pretty much tried every supplement, every treatment out there, and that process really changed how I see myself, how I understand health, and I wanted to share some of these things that I've found, and also invite some of these specialists that have really helped me over the years, to really just dive deeply into the topic with you guys. So, the reason for this as well is that hair loss is becoming so common amongst women. It's really, really prevalent now. Like, we used to, I think, associate hair loss with male pattern baldness, or like just kind of like a man thing. But I think that that it's not random that so many women are dealing with hair loss now. There are so many environmental and physiological factors that are contributing to hair loss, like endotoxins, microplastics, lower nutrient density in food, gut microbiome issues, autoimmune issues, chronic stress, hormonal dysregulation. Even things like hard water can affect the way that can cause our hair to fall out. And I think that women's bodies are extremely sensitive to these stressors, and hair is often the first place where the body begins to show signs of distress and dysregulation. So my personal hair story, like I said, I have PCOS. I always had like really beautiful hair. It was thick, bouncy, curly. My hair is styled right now, but it was really thick and curly. It was really like one of my most like prized assets. It was one of my favorite things about myself. And when I was about 19 years old, is when I started to express, like, that was the onset of my PCOS. And hair loss can happen like really slowly, like in the case of AGA, androgenetic alopecia, or it can happen really suddenly, acutely, all at once. There's an amazing dermatologist whose name is Jeff Donovan, a Canadian dermatologist, who talks about the difference between AGA, androgenetic alopecia, which is chronic and progressive, versus something like telogen effluvium, which is more acute and sudden and transient. It's that with AGA, the thinning is like slow and gradual. You'll start to realize over time that your hair is thinning, and that's because of the follicle miniaturization that happens Whereas with something like TE or telogen effluvium, it's more of like an immediate acute impact. And frankly, like both can happen when it comes to hair loss. Like you can have them together, and often they kind of do happen together with AGA. If you do have androgenetic alopecia, you can go through some bouts of TE. So I actually remember specifically about 5-6 years ago, I started realizing that my hair had become really, really thin. I'd say about 8 years ago was kind of when it was starting to become thinner after I had gotten into quite a severe accident. But over the years, I was addressing my other PCOS symptoms, which I didn't have too many. I think acne was one of the big ones. But I had treated that so successfully. I think I didn't even really think about my hair because it didn't feel like it was that dire, it was always still thick. I mean, I noticed it was thinning a little bit, but I didn't think too much of it. So, I think the interesting thing about androgenetic alopecia also is that, this part of your hair around this part is those follicles are genetically programmed to respond to androgens differently. And there are cases, like real cases of androgenetic alopecia where you see like within your family, within like your lineage, women upon women who have thinning, hereditary thinning. But I think in most cases today, and I don't know, maybe I'll get, slack for saying this, but I think in most cases today, what we're seeing is other forms of hormonally driven hair loss that mimic the AGA pattern, but are actually driven by things like insulin sensitivity or different hormonal imbalances and that sort of thing. So I think that true cases of androgenetic alopecia that are purely just genetic, purely genetic, do exist. And I think that we are genetically sensitive to the androgens, but I think that environmental factors are really driving this much more so than the genetic factors, I guess is what I'm trying to say. So what do we do now? Like you have PCOS, you have hormonal hair loss, you have hair loss just in general as a woman. What do you do? I will get into another video where I talk about this in a lot more depth, but if I had to simplify it, and I don't really like to oversimplify things, especially when it comes to something so complex like hair loss. But if I had to simplify it, I would say that there are 3 pillars. The first is androgen blockade. For women, this is like the foundational aspect that you must address the androgens causing the follicle miniaturization, whether you address it naturally, whether it's topically or via prescription. Different bodies need different tools and will respond differently to various pathways. But conceptually, what it looks like is that you block the androgens, okay? You treat those androgens like you treat your ex-boyfriend. You block them, okay? That's really important. But blocking the DHT is crucial to treating any form of hormonal hair loss. Number 2 is follicle stimulation. Is stimulation a word? I can't remember. Follicle stimulating the hair follicles, okay? Because progressive hair loss, you need to maintain the follicle health. Things like minoxidil will keep the follicles stimulated and bring blood flow to those follicles. There are other alternatives to that as well, which I can discuss in another video. But those are the 3 really. Oh, I didn't get to the third one. I'm just jumping ahead. The third one is hormone and nutritional optimization. You need to address anything underlying in the body that is, whether it's hormonal or nutritional. You cannot out-treat underlying dysregulation. You cannot out minoxidil iron deficiency. You can't out PRP thyroid dysfunction, you have to address what's happening internally. You have to look at your iron levels. Ideally, those need to be above 70 or even above 100, some would say. Your vitamin D levels need to be within the normal range. Your blood sugar and insulin regulation needs to be addressed. If you have AGA or if you have any hormonal imbalance and you are eating a high glycemic diet that's full of carbs and sugar, you are not creating the environment that is going to allow your hair to thrive. So if your body systems are out of whack and you are not seeing the results that you want from your hair treatment, that's why there are underlying systems at play that are causing and preventing your hair growth from maximizing. So that's really important. Things like PRP, low levels lasers, and microneedling or dermastamping, whatever, these are great and it can be complementary to the foundational things, but they work best on top of these core elements like androgen control, follicle stimulation, and internal whole body optimization. So for me, it was a combination kind of all of those things, in terms of like, it was like oral anti-androgens for some time, and then for a long time compounded topical treatments, which I truly swear by, and some really serious supplementation and nutritional work. I'll break this down more in other videos. But I just wanted to, I can see that my camera is dying now, my camera battery. So I'm going to try to wrap this up really quickly, but I will be back with more videos. Ladies, look, hair loss is not a lost cause. You know, science is advancing. The access to information is better than it's ever been. It does take work, but you just need to be diligent about your hair health. You need to address all the factors, but it is treatable. And most importantly, like, you deserve to feel confident in your body. You don't deserve to have to hide your hair and to style it in every which way and to do the fibers. And in some cases, it can be a little bit too far gone. There are, like, advanced cases of AGA or of pattern hair loss or of female thinning that can be too far gone. But in most cases, I mean, even in those cases, there's still recourse. Okay. But in any case, there is recourse. So, I had to figure out so much for myself, over these last years, and the access to the right tools and to the right resources was not available to me. So I just want to share that for anybody who might be out there who's feeling hopeless and doesn't know where to start. And thank you so much for watching my video, and I'll be back again soon. If you could like and subscribe and comment and interact with my videos, that would mean so much to me. And I'll be back soon.